Hi, I'm Dr. Molly with Your Goals Physical Therapy. Have you ever broken a bone or had a surgery and then been told several months after the surgery was completed and you should be better by everybody involved that your hand or arm, whatever it was that was had surgery, should be better, and that they consider the result of that surgery or the procedure as a win? Everything's great as far as we're concerned. But in your world, you still can't get back to the things that you want to do. You still have pain daily. You're still having a problem getting back to all the things that are important to you. That is exactly what happened to Isabella. Isabella is she's in her 70s, and she has been active her whole life. And one day, she's driving down the road, and somebody pulls out and hits the side of her car. She was going 30, and obviously they just pulled out, but just that collision, which doesn't seem like it should be that much, ended up fracturing her left ring finger, and so that knuckle was very badly damaged, and thankfully didn't need surgery, but it was casted, and it took about 2 months, almost 10 weeks for that to fully heal. And during that time, obviously your hand's fractured, then you can't really use your arm because you can't hold anything with your hand, you can't do anything. So that whole arm during that time got weak. And so when she went to therapy, because she's so active and able to do more things than what people normally consider a 70-year-old able to do, they sort of dismissed her lack of strength as just being part of the surgery. And even though things were still swelling, they're like, you're still doing great. Things just swell occasionally, and maybe you need to rest it some more. And so after a few rounds, and I mean like 6 to 8 weeks of physical therapy and 6 to 8 weeks of physical therapy and speaking with her orthopedic surgeon and her other orthopedic people, just trying to get all these people to understand that her hands still hurt daily. She still didn't have full range of motion. She still couldn't hold pots and pans. She still couldn't go back to swimming because every time she tried to swim, her forearm swelled up. And so they kept telling her to rest it and to wait, and she was getting very frustrated and starting to believe that this was as good as it was going to get. And here it is that Isabella is in her 70s and she has been active. And by active, I mean she has tried everything. She has done Pilates, yoga, she did martial arts for a while, she was into dance for a while, and the longest standing thing, her biggest love, has been swimming. And she still competes. Like, she does meets every month, if not twice a month. And she races and she beats records in her age class. And so she is just a very, very active person. And so to be told that you're just going to have pain holding onto a pot and a pan was devastating for her. And so she met me from a friend that referred her to me. And so we got to talk, and I was able to come over and do an evaluation. So after looking at her hand, seeing what was going on with her forearm, seeing her shoulder, I was able to see that it wasn't just a hand problem anymore. Like, her whole shoulder and now into her neck, she was even telling me she was having neck pain that she hadn't had before. So basically from her neck on down to her hand was having problems. They were being affected by this injury. And now this wasn't just an 8-week injury. This is pushing into 10 months that she's been dealing with this. And she's truly believing that this is as good as it's going to be. I mean, 10 months. I mean, how much longer can this thing take to heal? The bone's been healed for forever. But she still couldn't close her fist all the way. She still couldn't, again, hold a pot or a pan. Carrying groceries was a problem. And so this injury, which lawyers, doctors, everybody is saying that it's such a minor thing, was not minor for Isabella. It was very dramatic, and it was taking away a lot of joy from her life. And so when I start working with her, we were able to calm down the swelling in her forearm. We were able to come up with a very dynamic program that helps strengthen everything from her hand all the way to her shoulder and improve her neck, because you're not just one body part. Everything works together. So if your hand is weak, your shoulder does more work. If your shoulder isn't able to help it, then everything has a problem, right? So if it's not balanced, if your body's not balanced, lots of things go wrong. And so part of the healing process after any injury is trying to figure out what's injured and then what other things are going to help. And so without getting too nerdy on how all of that works, you are not just one body part. If something is injured, other things are being affected. So if the only thing being addressed, in this case, her hand, then you're missing out on a lot of other things that could be playing into why you're still having pain. So I'm happy to say that just last week, she was able to compete. She's, brushing it off like it's not a big deal because she didn't really do as well as she thought, but she definitely held her own. She wasn't in pain afterwards. She was just a little bit of soreness. But overall, she was able to compete. She didn't take it easier on herself, and her forearm didn't swell up. And that is such a better place than where she was just 8 weeks ago. And so here she is almost at the end of what probably feels like the never-ending journey for her. But she is going to be back swimming and competing at her full strength in not too distant future. And I just wanted to let anybody out there who just got told that, maybe this is as good as it's going to get, and they're feeling a little bit defeated, that not everybody's going to have that opinion. And there may be more things that you can do. It just takes a broader perspective, somebody who's going to have a conversation and talk to you and find out exactly what it is that you need to get better, and not just look at a general formula and say that people with this kind of an injury need X kind of care and you'll take X amount of time, because we're not built like that. We all have our own timelines, we all have our own history, and there's a lot of things to consider when you come and see a movement specialist to get you back to all the things that matter. And I hope you're having a great day.